Hi, I'm Dr. Jerry Hesch, a physical therapist at the Hesch Institute. I am a manual therapy innovator. I'm a pelvic joint expert. I treat the whole body. I assess every joint in my clients. And my client has a pubic joint fixation. I'm going to let her describe it. She is a pelvic floor therapist with 35 years of experience. So, did you want us to keep your face out of the video? Okay, we will do that. So can you tell us why you think you have this presentation, which I will later describe?
Well, I have had
Just come a little closer so it'll capture the voice better.
many years a lot of bladder and urethral pain and symptoms of a bladder infection, though the cultures are negative. So burning at the urethra, tons of frequency, urgency, and I feel like everything is just compressed against my pubic bone. And
take that a little further. Everything feels compressed against your pubic bone. So you're saying what?
I feel like there isn't enough room, as there should be, between my bladder and my pubic bone, where those ligaments should be free to let my bladder go up and down. I feel like there is a lack of space there that's probably putting a lot of pressure on my bladder and altering the signals to my bladder as to when I'm supposed to urinate, not urinate. So I feel like it's affecting not only my bladder and urethra locally, that system, but also the nerve signals going to my brain. So I do feel that this work that Dr. Hesch is doing is extremely important because my organs and these ligaments attached to my pelvic bones.
True. And you've had lots of visceral work. You have lots of women's health treatments.
Yes, I have. I've had pelvic floor, visceral treatments, and things temporarily get better for a while, but...
And you've had other workups for
yeah.
IC, for interstitial cystitis and all that. You've done the diet, you've done...
The diet, have had tons of cystoscopies and installations where they put DMSO and steroids and all this stuff into the bladder. And
I thought DMSO would work. I mean, it's a 4-letter acronym, so, you know, that should be a good thing, right?
Yeah.
Good. Well, so how much out of pocket do you think you've spent in response to this?
Oh my gosh. Thousands and thousands and thousands of dollars.
So are you going to give me a percentage of that if I help you?
Yes.
I don't like this hourly billing. There's like, I mean, that's all you get is an hour billing. It's just, it ain't right. So anything else you need to say before I show what I find?
No, you have pinpointed that I do have some misalignment, and that is exactly what I think I feel.
Okay. And yes, my findings are congruent with what you are telling me. Mm-hmm. So sometimes listening to the patient might have value, right? Her husband's a very brilliant internal medicine doctor, and he's smiling at me. This is a device for measuring. I don't even know what it's called. A plunger caliper. Okay, so I use this to measure the depth of the pubic joint. My friend Banu, and I'm gonna butcher her last name. It's like ACLIOU. In the Middle East, she did a glorious paper on the pubic joint. And the bottom line is that the measurement for width is done at the mid-pubic bone. I'm gonna have to get back in touch with her, but let me focus on what I see. As soon as I palpate over your pubic bones, it's like, it just feels really tight. And when a joint is restricted, I use the terminology bone energy. The most dense thing in your body, the bone, can feel pliable, but it feels like there's an enhanced density. Probably a soft tissue phenomenon that gives me that perspective. But I'm giving her a little bit of width for the symphysis, for the pubic cartilage. You know, you've had children. I don't know how wide yours is. The norm is 2 to 4. I'll bet you're a 4 to 6. So I know that I'm on the bony aspect, and there seems to be symmetry upper third, middle third, lower third. Okay. So there's no sagittal rotation. There's no superior inferior asymmetry, though I did treat one 2 days ago.
Yeah.
Did you have an inferior pube?
Yes.
Okay.
It was anterior.
Okay. Now, I'm going to now palpate the fibrocartilage. Okay. It is deep to the pubic bone. So I'm going to use my little tester. And so I'm going to do it at the mid-pube. Okay. And so I'm, you know, forgive me, but there's going to be a little bit of pressure here. Okay. So this black piece of it is firmly on the pube. It's perpendicular to the angle that the pubes lay in. And then I'm just going to push this little jobby, make sure it's loose so it'll move easily. And is that painful?
It's okay.
Sorry.
No, it's okay.
So I'm getting 1, 2, 3, 4, 5, 6 millimeters. Okay, which is close to 1/4 inch. Okay? And there's an absence of PA spring through the pubic bones. And I use a really mild force. When I do that, I'm trying to, just like on the femur, I push till it stops. Well, where are you taking up the slack? Hip joint, low back, knee. I mean, just look at everything that moves when I do that. I'm taking up the slack in this direction, even in the foot and ankle, right?
Yes.
So it's not like a highly specific test. You have to acknowledge, guess what? It's part of a system. So let's test it in that manner. And every joint that is normal has, and every bony structure has the ability to move to a stop point. And that's the load part. And then you spring and it should recoil. So you keep the force there. It's different than the tradition of orthopedic manual physical therapy. They do the load and then the spring and then they give it a grade. I have to feel the recoil or the lack thereof and the quality. I like to give a quality measurement, and that feels stuck. Okay?
Mm-hmm.
So let's have you lie on your stomach.
Okay.
So we have a fibrocartilage pushing against your bladder and any other midline structures. And so looking at the sacrum, and can you tell us what you felt in this area during your labor?
When I was birthing my son, I felt like my ilia were going to pop off.
Okay, in any direction, any particular direction?
Just laterally and posteriorly.
Thank you. Okay, beautiful. Thank you. Okay, now when I look at your PSISs, okay, well, I have 42 years of palpating PSISs, and I'm happy to have that conversation about inter-tester reliability. Okay, I have good intra-tester reliability validated in Luann Olson's master's study. So I'm paying attention to tone, not just position. Position is like the least reliable indicator of a movement impairment, but it's part of the data gathering. And here is your sacrum, and here's your PSIS. There's no sulcus. My fingernails hit each other. Okay, so it's rather interesting. Let's just move on. I'm going to do a midline posterior to anterior spring, and I'm capturing the first, second, and third sacral segments. What do you feel when I take up the slack?
It's not moving.
I don't.
Mm-mm.
I cannot take up the slack. It is not moving, and I cannot spring it with a reasonable amount of force. And if I double it, it's not moving. Okay. Now there's an interesting presentation with her ligaments. So we come out here, and you can only palpate sacrospinous through sacrotuberous. Okay, I'm lateral to her ILAs, and I'm not too far lateral, so I'm not on her spine of the ischia. and then I indent it. Okay, and I moved up a little bit because I was off the ligament, so now I'm on it and I move up above it. It's a very different structure. It's more ilium above that, okay? And I made the comment to you that that's more motion than I would have expected. Mm-hmm. And now when I locate the sacrotuberous ligament, about mid-belly, I can load and spring it. What did I say about it? That's more mobility in that ligament than I would anticipate.
Right.
Okay? So I'm going to treat her pube and bring that symphysis pubis anteriorly, and I will later decide if I need to do something differently to treat the sacrum. Okay, we're going to do one thing at a time. I'm going to stop filming here and we'll come back and film after treatment. I teach online courses, and I cover the pube in the lumbopelvic hip online course, but I'm going to integrate that also into the whole body. And I'm going to have a separate one on treating the sacrum and the pubic joint and coccyx. Thank you.